But I am, super curious from a standpoint of even with like what you've seen with patients that have breast implants. I'm super, curious from a standpoint of like, okay, what is it that turns on this gene? And I talk to my patients about this all the time. For some people, it can clearly delineate. It was a trauma like a motor vehicle accident, or it was like the stress of a divorce, or they went out and they had some sort of parasite that they know, or some type of infection they got, some food-borne illness type of thing. And other times it's a little bit harder to trace, but I suspect that for some people, it could be, hey, the toxins from something like these breast implants. And that is actually creating that epigenetic expression where all of a sudden, maybe for years, they've been in a moldy home that hasn't been bothering them. Because if that gene's not expressed, your immune system's not having a problem. And then all of a sudden, it feels like one day it's out of the blue. But it was just that there was another toxin or another something that actually triggered that gene to say express and turn on. And now somebody has that illness on top of, breast implant illness.
Yeah, I think it's to your point. To us, it seems very cumulative.
Yeah.
So they typically genetically are a little challenged in terms of capability of detoxification, especially in the liver, where predominantly we detoxify substances